largely depends on how you do in listening part A. So how can you improve your performance, or how can you make sure that you get maximum correct answers without missing any of them? The first thing you need to ensure is that you should not be missing one single blank. You should be attempting all of them. And we are trying to get maximum correct here, at least 20 correct here, because we know part B and C is more challenging. So if we are able to make up a good score here, then it would increase our chances of passing the test. So let us do the pre-listening activity. You have the context sentence here, which says with whom this conversation is taking place. So this conversation is with a neurologist. So the moment you read neurologist, you start thinking about the problems that neurologists usually deal with. And then you start looking at the subheading, history of condition. So definitely if they are visiting neurologist, they may have a neurological condition, and here it is history of condition. So in this part of the conversation, they are not just going to describe their presenting complaints, but how it evolved, how the things developed, how the condition has gradually developed. This is why you can see here the first point says first symptoms approximately blank after giving birth, and it is given 8 months ago. So after giving birth, when did the symptom start? So I'm looking for a time here. It has to be a time frame or timeline. And 8 months ago is already given. Now I have to find out after giving birth, after how many hours or how many days they started getting the symptoms. In the second bullet point, the neurologist has written partial loss of sense of blank, and where the loss of sense is also given, left side. So here I'm going to write a word related to senses. It has to be one of the sense. Which sense was lost? And we always pay attention to negative words. Loss. Attributed to. What do you mean by this? Attributed. Any idea? Why has the neurologist written here attributed to? What does that mean? Can you think of any sentence where you might have read attributed to, or you might have heard this word?
Attributed means assumption.
Assumption? No, that's slightly different meaning. Attributed to? Yeah, regarding something, or a more appropriate word would be caused by. What was the reason? When I say I attribute my success to my parents, so I establish them as responsible for my success. But here, why has the neurologist used word attributed to rather than caused by? Is because attributed to gives you a perspective of the patient. Caused by means it is definitive that yeah, that was the reason why they started developing this symptom. Whereas when the neurologist is using the word attributed to, that means it was the patient's perspective. Patient thought that it was because of something. So here, the type of word I'm going to use is the cause or the reason as per the patient. What patient thought could be the reason of their symptom. And again, after childbirth is given here. So this at least tells us that this condition has started after giving birth. Next day, so this was the first, next day, left eye and mouth both. And then you have kind of, inverted comma here. So this is exact word in which the patient might have described the symptom. So again, I'm looking for a, a neurological symptom. Now you start thinking about what neurological symptoms can a patient have which is related to particularly their eye and mouth for a symptom here. Then husband suspected, and this is very common in the when the notes are taken, to use arrow. So the arrow indicates led to, resulted in. So it resulted in emergency admission. Husband suspected something and therefore emergency admission. So what kind of word would I be looking for here? Is disease condition. Again, it was not the real diagnosis. That is why the neurologist has used word husband suspected. Then Bell's palsy was eventually confirmed. So this bullet points which are not assessed, they can also give you an important hint towards the symptoms. Then second set of questions you have is related to treatment. Now again here one point is already given, steroids. Always pay attention to also those bullet points which are not assessed, because they will help you to keep track of the audio, one thing, and they would also help you to ensure that you are not repeating something. So here it is given gauze padding for affected eye. So whenever you connect something with and on both the sides, you have similar kind of things because they both were used for affected eye. So can I think that this has to be probably one of the dressing material, or it could be something that was applied along with gauze padding. She also used blank to keep eye closed. So here I'm looking for a thing that they used, eye closed. No improvement. This is important. No improvement. MRI scan and blank administered. So usually word administer collocates well with the type of medication. But here again, because they both are on the on two different sides of and, you can expect that you would have a similar word here. So here the type of information that we are looking for is a test apart from MRI. Then this is very typical. The patient may tell that I have this kind of problem. They would say I have itchy rash, but the healthcare professional would put it in this way. The rash described as, the skin described as. So whenever you have this word described as, and after that if you have a blank, you would most of the time, 99% of the time, will have adjective there. Now here adjective for vision. So again you can start predicting what kind of adjectives can a patient use. Then recently blank, as a result no injury. So no injury gives you a key that it has to be an accident or an incident or a fall, something which can lead to injuries, but in this case it didn't. So here the type of information that I am looking for has to be an incident, but it didn't cause any injury. Unable to smile or blank. So whenever you have this word to before the blank, okay, to. To is usually followed by original form of the verb without ed, without ing. While writing also you can keep this in mind. So unable to smile, and what other activity that they were unable to do. So I'm looking for a type of action. And again, it is given discomfort in eye. So it has to be related to eye. And facial muscles, feel. Again, when you have feel after the before the blank, you are likely to have adjective. I feel tired, I feel motivated, I feel exhausted, I feel concerned. So feel is also followed by adjective, but here facial muscles feels. I'm looking for adjective for muscles, right? So this is, how much detailed prediction you have to do before the listening starts. That's the only way to ensure that you are able to follow the whole listening and you are not missing out any of the questions here. Another thing that you would have to keep in mind here is you cannot wait for the patient to use the same kind of words as you have here. For example, attributed to. Patient would not probably use this word as it is. They may, use more common phrasal verbs here. For example, they may say, I put it down to. Usually in the spoken language, we use this expression. If I want to say that, now I've been feeling very tired these days and I put it down to my age. For example, if a patient says, I put it down to my age, that means they think their age is the reason. Similarly, here it says husband suspected. So obviously you would not have the exact word. Okay? The patient might describe it by saying he thought, okay, or he doubted. So you have to simultaneously also think about the way in which patient would be describing, their symptoms. Similarly, here when they said that, she used something, but patient probably wouldn't say I used. They might say that I was given, or the pharmacist gave something, or maybe the doctor or the GP or the nurse gave this to me. Okay. Similarly, they wouldn't say scan was administered. They might say that I underwent or I had. Simply in spoken language, they can also say I had MRI scan. So the language that you would hear in the audio will be kind of spoken language, which is used by patient. Whereas the language that you have on your question paper is the language used by the healthcare professional, and this is note form. So what you hear is, say approximately 350 to 400 words, whereas what you have here is a very short description of what the patient has said. Okay, so these are the important things you need to keep in mind. Now what I'm going to do is I'm going to play the audio for this extract, and I want all of you to write your answers on a piece of paper. It's okay if you don't type in. I'll just, later on bring the answers on screen and you can then compare your answers with the correct answers. So I'm going to play the audio now.
So, Sandra, I understand you've been referred to me because you have Bell's palsy and it's been going on for some time.
That's right.
Okay. Well, first of all, I wonder if you could run through for me how this started, what treatment you've had and so forth. I have your notes here, but it would be good to hear it from your point of view.
Sure. It all began when my daughter was born. So that was, 8 months ago now. At first everything was fine, but after about 48 hours, I started to notice that my mouth felt funny. I realised I couldn't taste anything on the left side, I mean, it was strange. I could still feel my tongue okay, but that side of my mouth had gone sort of numb. At the time, I just put it down to tiredness. You know, lots of strange things happen to you during childbirth.
Indeed.
Anyway, when I woke up next morning, it had got worse. I looked in the mirror and I could see that the left side of my mouth was drooping, and my eye was the same. I didn't know what was going on, so I called my husband and he immediately rang for an ambulance. I mean, he thought I must have had a stroke or something. So we ended up in the emergency department.
I see. And Bell's palsy was confirmed?
After about 10 hours, yes. But I was told that this wasn't uncommon during pregnancy and childbirth, that I shouldn't worry. I was sent home with a course of steroids and told to go to my GP if it didn't clear up in 2 to 3 weeks. We felt quite relieved to hear that. I mean, it was uncomfortable, but they gave me some ointment to put on my eye and also some gauze padding to help me at night.
Right.
Because I couldn't even close it properly. Anyway, I couldn't get on with that, but fortunately my local pharmacist was able to give me some tape, which did help me to keep the eye closed at night. But it was tough coping with all this and having a newborn baby at the same time.
Of course.
Eventually my husband had to go back to work and I was essentially looking after my daughter alone.
So did you go back to the GP?
Yes, I did. And he was quite surprised to find that I was no better. So he sent me for an MRI scan to make sure that nothing else was going on. And, I had a full blood count at the same time.
Right.
Anyway, nothing showed up, and again I was told that it should get better of its own accord, but that it might take up to 9 months. Well, that's nearly up now, and I know better, so that's why I'm here.
I see. And in terms of your current symptoms?
Well, as you can see, I still have the facial palsy, and my eyesight isn't always very good, sort of blurry, if you know what I mean. I actually fell down the stairs last week, and I'm sure that's why. I didn't hurt myself, but thank goodness I wasn't holding my daughter at the time. Poor kid. I'm not even able to smile properly. And of course I can't blink either, which leads to a lot of discomfort in my eye, which still doesn't close at night. I really don't feel my face is getting better. In fact, I think the muscles are getting tight, even on the other side.
I see. So your GP has referred you to me?
Yes. I went to see her because I noticed something else recently. When I try to close my eye, that side of my mouth moves as well.
Oh, yes. Synkinesis, that's called.
Oh, right.
OK, well, thank you. That's helped me get an idea of what the problem is. Was there anything you wanted to ask me at all?
Okay. I hope each one of you was able to answer all the questions. Let me know if you couldn't answer. How many questions were left? Two left. Okay, not bad. One left. Okay. Okay, so that's great, and rest of you didn't miss anything. Okay, yeah, Dr. Fez says he has missed 5. Okay, you could answer 7 questions, not bad. Uh, Probably you might not have started practicing yet from the beginners. That could be one of the reasons. So practicing from beginners would ensure that you would be able to tune in to the conversation and pick up the answers as it goes on. Okay, so let us now discuss these answers. I'll just bring the answers on screen. Give me a moment. So sometimes, another reason why this sounded a bit difficult is because of, as you can see, the women is having Bell's palsy, and therefore, because of drooping, because of the muscular issues that she was having with her face, you can sense that her voice was not, that clear. So obviously, as a medical professional, this is very common situation that you may come across, because your patients may not always be in their best to discuss or describe things to you. So in that situation, how you handle that, that plays an important role. So here are the answers. You can match your answers with this. The words that are written in the bracket are optional. So even if you have not written those words, you can still consider your answer as a correct answer. Right? So see, we predicted time. So it says 48 hours. Sense of taste was lost. She said, I put it down to tiredness. Then the symptom was drooping, stroke, ointment, tape. The test that they had was full blood count, blurry, or here if you have written blurred, that is also acceptable. Then what incident they had is they fell downstairs. Then they are unable to blink and the muscles feel tight. So does any one of you have any query here? Maybe you might have written something different, and if you wanted to just check out if your answer is correct or not.
Some I'll write down tired rather than tiredness.
That's wrong.
Okay.
That's wrong, because we were looking for reason.
Hmm.
Yeah, so tiredness. We were not looking for adjective. So that ensures, as Dr. Faiz, that when you are able to pick up the answers, they are all correct. But we'll have to ensure that we're not missing out any of the blanks here. Should be able to answer all the questions. Okay. Any other question from this part? Okay, that's great. Now, let us move on to the extract 2. So this is extract 2. Here it is a conversation with gastroenterologist. So again, you can predict what kind of discussion they would have with a gastroenterologist. This time, I'm giving all of you 3 minutes time to predict the type of word. And I also want you to write it down in the chat box. Write all of them together. Only send in once you have typed all of them. Okay? And write them with number if possible. So I'm setting the timer, considering that you also have to type. So I'm setting the timer for 5 minutes, and I want each one of you to type in, each one of you, okay, to type in your predictions for blank number 13 to 24. I don't want you to predict the exact word. I want you to predict the type of word. Are you looking for a symptom, medication, adjective, noun? What kind of information are you looking for? Do not send one at a time. Send all of them together so that I can view it. Okay. Great. Almost everyone has done good job in terms of, yeah. Okay. Now, one particular blank where I think some of you have made error is here in when it says pay attention to the blank of food, and almost everyone has written type of food here, which is not appropriate, because if it was type of food, then the of wouldn't be there. Yes, I would say junk food, I would say vegetarian food, I would say any type of food. If it was there, then the word of wouldn't be there. So 22 is less likely to be type of food. It is going to be a characteristic of food. And in 18th, some of you have written disease condition, which is wrong, because it says analyzed in ED. So can I analyze disease condition? No, disease condition can be confirmed, can be established, can be determined, can be diagnosed, but not analyzed. What can be analyzed is, maybe a body fluid, or maybe the function of a particular organ. So 18th is more likely to be one of the body fluid or one of the body functions that was analyzed. So if you are aware whether you are looking for a noun or an adjective, that is very, very helpful, because the error that we just discussed for the first one, tired and tiredness. So those kind of errors can be eliminated, because put it down to. So put it down to, I was looking for a reason. So tired cannot be reason. I was looking for a noun there. So tiredness was appropriate word there. So it's important that you know what kind of information you are looking for before the audio starts. Okay. So now I'm going to play this audio. Okay, and all of you are supposed to write answers. You don't need to type in. You just need to write it for yourself, and then I would discuss the answers.
So, Declan, you've been referred to me because you've been experiencing digestive problems. Before I examine you, perhaps you could tell me in your own words the history of the condition.
Well, it all started about 3 years ago. I suddenly found I was having issues keeping food and drink down. So I went to the doctor and he said, well, what you're describing, it sounds like acid reflux. Well, I'd heard of that and I didn't think that's what it was. Anyway, he prescribed a course of H2 receptor blockers and said, just try, and if this doesn't work, then we'll schedule some tests.
And?
Well, I was right to be sceptical because they didn't work. So I ended up going for an endoscopy, and my GP was surprised. He said, you were right, there is something else going on. They'd taken a biopsy of my stomach, and there was a problem with the bacteria there. So he put me on a triple antibiotic, and I was on that for 21 days.
And did that help?
I did feel a bit better, but if I ate certain foods, they'd still get stuck in my throat, like when I was eating bread, that sort of thing. Then fast forward to this time last year, and I had the same episode again. I just couldn't keep the food down. Only this time, it wasn't only that. I also had a feeling like my stomach was burning. It was horrible, like my insides were on fire or something. I thought it would pass like the other symptoms did, but actually it just got more and more intense, so I called the hospital and the paramedics came out to get me.
So what happened there?
Well, they did some tests. They took a stool sample, and they told me they were going to analyse that to see what was going on down there. Anyway, eventually I was told I'd been diagnosed with colitis, and again was prescribed antibiotics. So I took them, but within an hour or two of taking those pills, I was throwing up again.
Right.
So I ended up back in hospital because I couldn't keep anything down, and I was really suffering from fatigue. I was having trouble even standing at this point, and basically everything hurt. So they admitted me and put me on an IV for fluids because I was dehydrated and malnourished.
And they did more tests?
Yes, this time they gave me a barium swallow test and took an x-ray of my chest area. What that showed was that I had a disorder in my esophagus. Basically, the endings of the nerve cells are supposed to move the food down my esophagus to my stomach, and so signal to my LES muscle to relax and allow the food into my stomach. But because these nerves aren't working, there's no signal and the muscle doesn't open.
So they diagnosed achalasia?
That's right. They told me I'd have to manage the condition somehow. I mean, that's okay because it's not all the time. I have these episodes where I can't keep anything down. Then for a while I'm okay as long as I'm careful. I keep to a mostly liquid diet or go for food that's easy to break down. I watch the texture of the solid stuff I eat and keep to small portions. Another thing that's helped is having carbonated drinks at mealtimes because burping helps to get the LES working.
That's right. Okay, well, I think I've got the picture now. Next, I'd like to ask what you're hoping I can do for you.
Well, I was looking on the internet and I saw that there's a new form of surgery that's been developed that might make a difference to me. My GP said you'd be able to tell me about that.
Okay, well, let's begin by analysing.
Okay, so this time, if you have missed any of the answers, just type in how many have you missed. Okay, 2, 1, not bad. That's a great progress, Kishan. How about you, Praful? How many have you answered? That's a great progress, Pankti, for you as well. Not bad, Praful. If you just missed 3, very good. Okay, So now I'll get the answers on screen. Okay. Match this with your answers and see if you have got correct answers. But fire would not be type of sensation. Yeah, that is why the prediction is important. The patient may describe it in that way, but the correct answer is burning. We must write burning. So, I would just like to show you how the patient's language was used here and how, you cannot expect to have the same words. For example, here, the patient said that, well, what the doctor said, well, what you are describing, it sounds like acid reflux. So he never said that he was diagnosed with acid reflux, right? Similarly, he never, used words like here, when it says that they had some test. Okay, so the patient's kind of language will be different from the language that you have written on your question paper. Similarly, instead of vomiting, he was every time using a typical phrase that I was unable to keep the food down. So these are the typical phrasal verbs that your patients would be using, and it's important that you get familiar with this kind of phrasal verbs. Couldn't keep the food down. So what does it mean is that they were just not able to, kind of eat anything. The moment they eat anything, they used to get vomiting. So this is a typical expression that your patient would use. To be unable to keep the food down doesn't mean that they have any issue with the swallowing. Yeah. So that, make sure that you are not misinterpreting that. To be unable to keep the food down means that they had vomiting as soon as they ate something. Then similarly here they said that, I had a feeling like my stomach was burning. It was horrible, like my insides were on fire or something. But the sensation is not fire, it is burning. But typically, again, they wouldn't say burning sensation. So you're not, waiting for the exact words to be used, and that's the main challenge there. And again, here the patient used, I was throwing up again. So they wouldn't say I had a vomiting or I had episode of vomiting. They would use this kind of phrasal verb to throw up. To throw up means to have vomiting. So it's important. To end up means to result in. I ended up back in the hospital. So ultimately, I had to be admitted to the hospital. That is what they were trying to explain here. So in one of the ways of improving your score in listening part A is also getting more and more familiar with the patient's kind of language. Excuse me. The patients would be using their own way of describing, and what you have written in your question paper is the language that healthcare professional has used. So this phrase was quite often repeated here, couldn't keep anything down. Okay, and then I watch the texture. So in your question paper, it is given that pay attention to. Yeah, but obviously patient wouldn't use that kind of standard expressions. So watch the texture of solid food. So the characteristic of food, that is the texture, that is what we were looking for. And the new form of surgery. Okay. So even when you are practicing from beginners or intermediate book, make sure that you are following this strategy. Do not do it just for doing it. Do not do it in exam. You are going to just get 30 seconds time for prediction, but you shouldn't do that when you are doing beginners or intermediate. The focus is on the quality. Once you enter in the advanced practice, that's the right time for you to focus on the to try to complete the task in the given time frame, so that you can ensure that in exam you are able to perform well. Okay, any question from this? Any general question? As far as listening part A is concerned, spelling errors are acceptable, okay, as long as the sound is correct. So for example, if the correct answer is pneumonia, and if you have written pneumonia, still you will get mark, because phonetically the spelling is correct. So the reader should be able to understand what you are trying to convey here. So as long as the sound is correct, the phonetical spelling is correct, you don't lose the mark. So don't worry much about that. And as I said, it is not the test of your grammar. So even if you have not written articles A and the, that's perfectly fine. They are optional. This is note form. So in note form, there wouldn't be articles wouldn't be compulsory. Yeah. Okay. So if you do not have any questions, then please type GA. If you have any questions, feel free to ask. Now we are going to move to listening part B. Nine correct is a very good progress, Dr. Faiz. From 7 to 9, that's great. Okay, so now let us move on to part B. Okay. So again, in part B as well, prediction is very, very important. How you are interpreting the question and how you are decoding the answer choices before the audio starts. That's the key. In listening part B, you have 6 extracts, and each one of them would have one question. So a total of 6 questions. They will all be related to workplace. Most of the conversations will be related to um, conversations that take place between two healthcare professionals. It could be in form of handover. It could be a general discussion on a change in a policy, or it could be junior doctors asking questions to the seniors. It could be seniors training the juniors on a particular aspect of the care, or it could be safety briefings that usually take place between the administration of the hospital, team briefing. I mean, the the head of the department briefing the whole team about the plan of a particular patient, or plan changes in the policy again, or it could be reporting or discussing the incident which may have happened on that particular day.